Streaming online. Yeah.
Yeah, okay, fine, sir. So here we will be discussing about what are the important points which you have to discuss regarding preventive and social medicine, and also the aspects where the small important points regarding the PSM and the campaigns will be asked here. So here we'll be discussing first about the Gobi campaign. This Gobi campaign was asked in one of the classes. One of the question aspects, it was called regarding the what is the Gobi campaign. It was done by the UNICEF, where the child development strategies were maintained here. So the child development strategies were mainly in the cases of growth chart. There were growth charts, oral rehydration, breastfeeding, and the immunization. So overall, you can consider it as Gobi campaign, like the child is Gobi, or Gobi is a child name, like that you can mention here. And other than that, when you have the things of COVID-19 also can be asked here. So it is like 2019, how the case identified, and 31st of December 2019, how China reported the cases. And when you come to there, the SARS-CoV-2 vaccines were there, and the first death was reported in China over 2020. And when it is came to 30th January, the first report in India came there. And the other one was regarding the vaccination in India started on 16th January 2021. That was there. And when the newly emergent coronavirus, that is the SARS-CoV-2 virus, has started on December 14, 2020, a new strain in UK started there. And till up to this, you have to remember the Ayurveda Setu apps and also the Ayurveda Setu, it was on 2020, mainly in 11 languages it was done. So in 11 languages, the Ayurveda Setu was released there. And you have the incubation period of about 2 to 14 days for COVID virus. Then the suspected cases were also mentioned. Like the suspected cases, you have the symptoms like the acute respiratory illness, and you have the travel restriction, and healthcare workers were always the suspects there. Respiratory infections were there, and the test positivity cases were also there. And some of the cases where the laboratory confirmed cases were there, and you have the contact cases also. And these are all about the PPE kit, how it should be worn, like the gloves, body gown, and the shoe cover and mask and the face shield with the 2 pair of gloves will be there. And this is the PPE kit removing factors. This also can be asked because it is coming under the preventive and social medicine aspect. So here we have the shoe cover and the outer gloves, the face shield and the gown. So first you have to start with the shoe cover, then with the outer gloves, the face shield and the gown, and the inner gloves will be removed. And next, afterwards, only the new gloves can be taken. And the last will be the mask. So directly starting from the shoe cover to mask will be the things. And these are the toll-free numbers were there, and these are the main vaccines which was done. So it was having a period from first to second doses, like the 3 weeks duration, and modern RNA like that 28 days were there, and Sputnik for 21 days, and the Covishield for 12 to 16 weeks, and the Covaxin for 4 to 8 weeks were there. And these were some of the breakthrough by mRNA COVID vaccine by Kefalin Carico and Drew Weissmans. And here we have the vaccines, how it was extracted. There was a type of monkeys where it was extracted there. And this was one of the case. And other than that one, you have the cases where like the STDs or food poisoning also, some of the areas where the question can be asked here. So the first one is regarding the food poisoning here. So the food poisoning, whenever we think the salmonella food poisoning is there, up to 12 to 24 hours, the salmonella food poisoning is there. And when you think of the staphylococcal virus, staphylococcus bacteria, it is about 1 to 6 hours, and the botulinum bacteria is about 12 to 36 hours. These are all the incubation period of major food poisoning causing changes. So you have the Bacillus cereus and the Bacillus diarrheal form, which is having an incubation period of 1 to 6 hours and 12 to 24 hours is there. And when you think about the obesity cases, there are some cases like the obesity where the BMI is equal to weight in kilogram by height in meter square. That also when some of the questions, height in meter square. There also you can assess the skin fold thickness. Main skin fold thickness can be assessed with the mid triceps, biceps, and the subscapular. These are the 3 things: mid triceps, biceps, and the subscapular. So you can consider it as MBS: mid triceps, biceps, and the subscapular. And there is also single best measurement like the mid triceps And you have the waist height ratio, like it is the best indicator of the cardiovascular risk, like the waist and the height ratio, how much it will be there. So, and then if the waist and height ratio is greater than 1 for the men, there will be severe risks of obesity there. And if it is greater than 0.85, there will be obesity in the cases of women there. And also there are blindness cases where the visual acuity and the major cause is the cataract there. So the visual acuity is less than 3/60 in the better eye. That is what the World Eye Foundations have been told. And 2017 to 18, there are the guidelines which is told that visual acuity is less than 3/60 there. And one of the major causes where the blindness causes is there regarding the cataract there. And there is Vision 2020, which says regarding right to sight, and is also global initiative by WHO. These are some of the programs where the questions can be asked there. So this is a global initiative by WHO and the international NGOs here. And some of the health programs which can be asked is like the TB programs are asked there. That is the Barometer of Social Welfare in India, and also Bacillus Discovery that was done by Robert Koch there. And when you diagnose the RNTCP conditions, the RNTCP, it is by seal stain. You have to remember RNTCP. That is tuberculosis control program. It is by Zeal stain, like that you have to remember. Zeal stain, Zeal Nielsen stain. That is the formula there. And World TB Day, it was on 24th March. So you have to remember, like TB people will be marching. TB people will be marching. So how you can correlate that? TB people will be marching. It is on 24th March. Then in the health programs, DOTS has been mentioned. So DOTS means the directly observed treatment short course about, which is an initiative by the government. And there is also National Polio Elimination Program is there. So it was launched in the year 1995 to 96, where the pulse, meaning it is sudden there, and the OPV on a single dose to mass people, it was given there. So that was the NPHC program. And there is also some of the things like the contraceptives are there. So contraceptives are the CPR, which is mentioned, the couple protection rate. And the indicator of contraceptive prevalence is that CPR is like greater than 60% above. And some of the contraceptive methods are the condom method and the vaginal sponge methods are there. Condoms, we know, it is protecting from the HIV and other kinds of STDs here. And there is vaginal sponge here. So the vaginal sponge, mainly the Today is the brand name for the vaginal sponge here. So it is a barrier and the spermicidal method which can be generally used here. Then coming to the IUDs. The IUDs mainly the 7, 220 and the 380 are there, the copper T. The side effects of IUDs are like that, bleeding and the pain will be there. And there are Mala N and Mala D is there. That is a combined oral contraceptive pills here. Mainly ethinyl, estradiol and norgestrol are the contents of IUDs. So you have to remember the Mala D and Mala N. So IUDs are coming there, a combined oral contraceptive pills. And the main benefits of oral contraceptive pills is there, like it is also helpful for ovarian system. That is why the people who are having the problem in the infertility and the conceiving problems will be kept on a specific doses of contraceptives for a stipulated time period, because it is believed that these oral contraceptives have an effect on the ovarian cyst of the females and for preventing the ovarian cancers. So that is the oral contraceptive pills. And there is benign breast disorders and the pelvic inflammatory diseases, also in ectopic pregnancy and iron deficiency anemia here. And there is also the Saheli is there, like the synthetic non-steroidal oral contraceptive pill that is called as the Saheli. And the depot is there, that is the injectable hormones that can be injected, and it can be slowly transdermally, the patches can be attached here. Or otherwise nothing is possible means you can go for the sterilization and cost-effective methods of it. And other than this one, you have these are about the contraceptive parts you have to take. I'm telling in short because that is only needed for the pinpoint parts of it. Okay. Next, we go to the other points of national child health. Okay. So we have the National Rural Health Mission, that is the NRHM in short, which is told, and it was launched in year 2005 there, the NRHM programs. And here the goals is like whenever the NRHM or the National Rural Health Mission is being taken up, there will be reduction in infant mortality and mother mortality rate is there. So, and it is always accessible to public health services, like it can control the communicable and the non-communicable diseases there. Also, a primary health care can be possible to the village areas there. And you have the population stabilization, gender and the demographic balance there, where the local health traditions and mainstreaming Ayush, mainly the Ayush can be mainstream. That is why NRHM clinics can be promoted with the Ayush clinics there. And you can have a promotion of healthy lifestyles with the yoga and Ayurveda medicines there. And what are the strategies being adopted by the NRHM programs? So the thing is that it can enhance the Panchayati Raj institutions, like the Panchayat Raj can be propagated and more public health services can be managed there. And you can access the health care at your doorstep only, at the house level only, with the help of ASHA workers there. And the health plan for each village is there with the help of health village committee is there. And overall, the sub-centers, the health, there is a community health center, and there are sub-centers of PHC there, which can have multi-purpose workers, and each village or each areas, they give the most accessible health services even to the rural villages also. And there is also the district health mission is there for the drinking water, sanitation and hygiene is there, and for the nutrition also. You have the technical support from national, state block and the district level traditions there. There will be reorienting medical education support to the rural health issues, and the mainstreaming Ayush revitalization local health is also there. Next, these are the national programs related to mother and child health care there. So mother and child health care main object is there. It will reduce the maternal, infant and child mortality and morbidity there. And overall, it will increase the reproductive health there. So you have the physical and psychological development of children. And also what are the services which will be done. So you have to remember there are 2 doses of TT which is given for the mother there, and also the iron and folic acid tablets. These are the kit which is coming. And there are different programs which are run by the government. Like the Arunima project is there. Arunima project is like iron deficiency anemia or HB reducing effects and all. This can be managed there. And you have the screen woman, which is pregnant for any of the risk factor, whenever the age is less than 35 years over the 35 years. Or if the height is less than 145 centimeter or above 70 kg. These are all the risk factors for pregnancy there. And there is any bleeding in the previous pregnancy there. Also, any history of stillbirth or history of cesarean section are also the risk factors there. So such risk factors can be identified by the health workers, and proper care can be given through the ASHA workers and the nursing staffs of the nearest PHC. And also for the care of the children, the activities which are maintained is that the growth of children can be monitored there. Thereby, the malnutrition can be detected and the immunization schedule can be given there by the help of common ailments there. And you can refer the case to higher centers also. Thereby, national health policies are maintained there. You have the integrated child development. This is another scheme under 1975, which is targeting the holistic development of the children. You can improve the nutritional and health status of children between the age group of 0 to 6 years. Thereby mortality, morbidity and the malnutrition and the school dropouts can be reduced up to a limit. So the school dropouts can be also reduced up to a limit by the midday meal programs also. And there will be psychosocial development of the child also. And there is effective coordination of policy and implementation and all is there. We have the beneficiary and the services. The child below 3 years of the age group is the beneficiary. There will be health checkup and proper immunization schedule with a supplementary nutrition that is given for the children below 3 years. If it is the children between the 3 to 6 years group, they are the preschool people. So that is why the preschool education and health checkup with the supplementary nutrition will be given. Supplementary nutrition is there for up to the age of about 15 years there will be there. Up to the age of 15 years, supplementary nutrition will be there. And the expectant and nursing woman will be there, where the health checkup can be given and the TT can be given there. And the nutrition and health education programs, especially the puberty child or the puberty women, the expectant and the nursing woman also, they can be aware of the nutrition, health education, the menstrual awareness and all can be taken there. Then the other program is regarding child survival and safe motherhood program. It was incorporated in 1992 there, thereby reducing the infant mortality there. And it produced the antenatal care to all pregnant women, which ensure the safe delivery services there, which provides a basic care to all the neonates here. And this is all about the reproductive and the child health. That is the RCH program here, the family welfare and the management. That is the RCH program in the 1997. And the main objectives of this RCH program is that there is first referral unit is there at the sub-district level, which provide a obstetric and newborn care there. And also the facility for MTP and IUD insertion, which is done at the PHC level there. And specialist facility for the STD and RTI, which are all available in the district hospital there. And these are the components of RCH there. Like you can prevent the RTI or the STDs there, and family welfare and planning, safe motherhood, and the child survival and the adolescent practices can be done there. And what are the services provided if it is the children, reproductive and child health? So mainly thing is that antenatal care can be maintained there, and the vitamin A prophylaxis and the exclusive breastfeeding and the immunization is also included under reproductive and child health. And for the mother, mainly tetanus toxoid immunization and the anemia can be prevented and treated there, and delivery by trained personnel can be done here. So also you can manage the obstetrical emergencies happening, and the birth spacing can be done in between these two ages can be also done here. And for the eligible couple, the pregnancy can be prevented there. And the safe abortion techniques, what it is, these are all the main objectives here. When we coming to the reproductive and child health, there are phase 2 is there. Phase 2 has been done in 2005 there. So there is operational PHCs and CHCs, round the clock delivery services were done there, and which strengthened the referral system there. The other one is regarding IMCI. There is an integrated management of childhood illness, which was done by the UNICEF and WHO. Here the components is there, like case management skill of health providers are done, and overall health system can be managed here. You have also the IMCA beneficiaries are the people under the 2 months age period, and the care of infants from 2 months to 5 years are done there. And these are the IMNCI guidelines. 2 months of age to any kind of bacterial infection or jaundice or the diarrhea can be managed here. And 5 years routinely assessed for nutritional and immunization status. And their signs, depending upon that, the color-coded classification has been also told. Like this is similar to the triad system of color coding here. So here, the home management is for a green. So you have to remember, for green color or green flag means you have to sit at home. If it is a yellow flag, there will be a specific medical treatment or device. Specific medical treatment or an advice should be done there. And if it is having a purple color, there will be urgent hospital referral or admission should be done there. And there are national programs which are related to the communicable diseases also. Here we have the National Program of Immunization in 1985, and the Acute Respiratory Infection Control Program is there. There is Diarrheal Disease Control Program in 1971, and the revised National Tuberculosis Control Program in 1962. Also, Leprosy Eradication Program of 1955 and the National Vector-Borne Disease Control Program. So here, the important one is regarding National Tuberculosis Control Program. So National Tuberculosis Control Program was in 1962. So NTCP, like that, National Tuberculosis Control Program here. So it was in the year 62. So 62 tuberculosis or 62 tubes, like that you have to remember. 62 tubes, like that you can remember. So 62, it is a National Tuberculosis Control Program. There is National Program on Immunization, which was in the year 1974 there. There is Expanded Program of Immunization or the EPI programs here. Here the Government of India has launched this program in about 1978, and in 1985 it was considered or converted into the Universal Immunization Program there. You have also the immunization coverage and the quality of service which improved here, wherein the self-sufficiency in vaccine production can be done. You can train the health personnel, and also you have the district-wise monitoring there. These are the revised immunization schedules there, and also you have the Mission Indradhanush, which is mentioned there. And the acute respiratory infections control program is there. That is in 1992, the program was launched, and it was implemented in 1992. And the patient will be treated with the antibiotics. And the revised National Tuberculosis Control Program is there. There is also Project ASIA, like that it is mentioned. Project ASIA, if you have the recurrent cough or cold since 2 weeks, you have to approach the nearest PHC center, like that. You have seen the advertisement in the television and the radios. These are some of the things like Project ASIA. So the goal of tuberculosis control is that it will decrease the mortality and the morbidity due to tuberculosis and cut the transmission of infection until tuberculosis ceases there. And the main important objectives is that 85% cure rate. You can just tell them 85% cure rate for the sputum smear positive TB patients here. And this is a strategy for the dots there. So here the dots are like good quality drugs and right treatment with that. These are the main drugs which can be given in the case of dots there. This can be asked. Name one of the drug which can be given in the case of dots. So you have to mention the streptomycin. Usually in the option, streptomycin may be there. Streptomycin, ethambutol, pyrazinamide, rifampicin, and aniline. So you have to remember rifampicin and streptomycin. These are the two things which is generally given in the cases of dots treatment strategies there. Then you have the TB cases and the treatment riches, like the how you can categorize the people, like the category 1, 2, and the H1 there. The category 1 is like new sputum smear, which are the positively seriously ill people, like the seriously ill and the extrapulmonary people there. The HRZ is 24 doses and 4 HR is there. That's 54 doses there. There is control of diarrheal disease or the CDD program there. Thereby, you can train the medical person and other health personnel in standard case management of diarrhea. And you can instruct the mother in home management of diarrhea and the recognition side. And the ORS salts can be of packet for free cost there. Mainly in dysentery conditions for the babies, clotrimazole and naltrexonic acid is given for 5 days with the ORS here. And the things like breastfeeding, freshly prepared weaning foods are also there. Then the other one is regarding leprosy control program there. So you have to remember like 55 leopards are coming, 55 leopards. So 1955 and the leprosy control program. And it was launched in the year 1955. But the leprosy eradication program was done, or the complete removal of leprosy was done in the year 1983 there. So you have the domiciliary treatment, the multi-dose treatments there, and mobile leprosy treatments units with the help of PhD staff was maintained there. And the next one is regarding the National AIDS Control Program that was in the year 1987. Here the National AIDS Control Organization is there in the year 1992, and the NACP Phase 2 and the Phase 3 are there here. So the main objective is that you can prevent the infections, you can have the care, support, and the treatment system here. Thereby infrastructure, the systems, and the human resources can be maintained here. You have the strategic information management system also here. When you come to the strategy, how to control the AIDS, the strategies, the surveillance of HIV infection that is done by the serum positivity test there. There are also disease control strategies, especially in the cases of sexual activity or in the case of drug addicts, you can make them aware, and the HIV infected blood transfusion. Priorly, the blood transfusion should be checked. And mainly the counseling sessions there, and maintaining the confidentiality of HIV patients here. Blood bank should be licensed, and voluntary blood donation with the screening of blood for HIV conditions, malaria, hepatitis B and C can be done. That's all. Then the National Vector-Borne Disease Control Program is there. Here NVBDCP, that is an umbrella program you can tell. So in this umbrella program, this vector-borne diseases gives protection to 6 kinds of diseases. They are malaria, dengue, chikungunya, Japanese encephalitis, Kala Azar, and the filaria programs. And this was done in the year 2003. So you can remember an umbrella, and here under the umbrella, you have the 6 diseases. That is the malaria, dengue, chikungunya. So you can remember like MDC, JKF, MDC, JKF, like that you can remember. So then NVBDCP is an umbrella program for prevention and control. You will get it there. And there is National Malaria Eradication Program in the year 1953. So here there is National Malaria Control Program in the year 1953, and in the year 1958 there is National Malaria Eradication Program, and in the year 1977 there is the plan of operation there. Then you have to just remember that year 2000 was the National Anti-Malaria Program was introduced there in the year 2000. Then what are the objectives you can do? Like you can prevent the deaths, you can reduce the sickness, and the vector-borne control by the house sprays in the rural areas can be done here. The other one is regarding the National Filaria Control Program in the year 1995. So here the control in the urban area by the anti-larval measures and the anti-parasitic measures by the control in rural areas, and the anti-larval measures by annual single-dose mass drug administration is there. The less strategized plan is regarding the Kala Asar Control Program in the year 1991, therein the interruption of transmission for reducing the vector population by undertaking indoor residential insecticidal spray, which should be done twice in a year annually. Okay. So you have the education programs there, and dengue and hemorrhagic fever control by prevention and control there. So first is the surveillance and the vector control and the capacity building. Nutritional deficiency diseases there. So in that one, year is very important there. The special nutritional program was in the year 1970, and the midday meal program was in the year 1957. So midday meal program, MDM. So you have to remember like MDM was done by taking the MDM, a 57-old person was taken off charge. MDM, that is MDMI, but you have to remember here MDM, midday meal program in the year 1957. There is anemia prophylaxis program in the year 1970, and the National Iodine Deficiency Diseases Control Program there. Special nutrition program was there. It was in the year 1970. And here the child born up to 1 year and child between 1 to 6 years and the women are there. How much kilocalorie you need to have, mainly in the cases of nutrition in the poor health. That is midday meal program. Here, the nutrition status of primary school children is raised there. Thereby, the attendance, the school dropouts can be reduced, with maximum enrollments in the schools there. Here, mainly any caste of people or any backward community or even the scheduled tribes are given more priority, especially in the cases of school holidays and all. They will be given lump sum amount of grains and the rice, which is needed for a family to survive there. And here there is mentioned like 1/3 part should be total energy and half part should be the total protein there, which will be provided at the low cost, and it is easily prepared with locally available food. And most of the time it will be frequently changed there, and this will all be done by the special educator of the district there. So it's about within the age group of 6 to 11 years, about 300 calories of proteins and will be given there, and 200 days, up to 200 days in a year will be given there. There is anemia control program, like mainly if the anemia control program has to target, it's in the year 1970. So you have the protein program, that is this program. Midday meal program was in 1970. The special nutrition program is there. This was in the year 1970 there, the special nutrition. So other than the special nutrition 1970, you have the anemia control program also there. So when you don't take proper nutrition, you will get anemia. So both are in 70s. So you will get anemia and proper nutrition not there means you will get both things in 70 years of age. So 1970 you have to manage that. Then the National Iodine Deficiency Control Program is there. This was in the year 1962. There is an NGCP was launched there, and it was changed into National Iron Deficiency Control Program. Mainly the goiter control program. Mainly the common salt was banned, and there was production of salt iodization and the universal salt iodization. Every 5 years, this is surveyed, and the health education and publicity is also done. The national programs, which is related to control of non-communicable diseases. These are the main programs programs which is done. The minimum needs program, the National Family Welfare Program, the National Program for the Control of Blindness, and the National School Health Program was also done. That was in the years 1977, 1988, 82, and the 1963. One of the important things should be always taken as care is regarding the National Cancer Control Program. That was in the year 1975 to 1976 there. There is National Water Supply and Sanitation Program in the year 1954. School health programs are there, which was launched in the year 1977. So mainly is there education, health education and all. National Mental Health Program in the year 1982. So, you know, the mentally ill should be treated and the rehabilitation, the prevention and promotion of positive mental health. These are the main criteria which is told there. And you have the mental health services which should be done at the district level there, like improving the facilities in the mental hospitals and the training of PHC personnel there at the mental hospital. These are the main thing there. And you have the substance use disorder which is done there, substance use disorder. National Program for the Control of Blindness, it was in the year 1976. And you have the trachoma control program in 63 and 76 you have the visual impairment and control of blindness. And blindness, it is included in the 2020 programs there. And vitamin A deficiency or vitamin A prophylaxis program. This is mainly intended for the people between 6 months to 5 years there. You can administer the IV dose at a dosage in between 6 months interval. So it is 6 to 11 months, 1 to 5 years, and all. A total of 9 doses should be given for the children. So you have to remember the 9 doses there. The vitamin A deficiency, especially by the breastfeeding, the green leafy vegetables, yellow colored fruit. And you have the National Cancer Control Program in the year 1975 to 1976 with the District Cancer Control Program in the year 1991 and 92 there. And the revised programs are the Regional Cancer Center Scheme is there, and the Oncology Wing Development Scheme, and the District Cancer Control Program. The National Diabetes Control Program is there. Here, the small unit is launched there, and you have the national policies here. And the National Water Supply and Sanitation Program, which was in the year 1954. You have also the Drugs and Magic Remedies Act, which was in the year 1954. So sanitation is a magic. Sanitation is a magic remedy, like that you can remember here. We have the So Jaladhara program. It is also a participatory program, thereby safe drinking water in rural areas and better hygienic practices there. Then the minimum needs program is there, that is the MNP. So improving the living standards of the people and social and economic development there. So you have the rural health, rural water supply, and adult education with the nutrition there. National Family Welfare Program is there in the year 1951, and the MTP Act was introduced in the year 1972. And after that, the amendment has come in the year 2019 for the MTP Act there. And in the year 1975 to 80, the Ministry of Family Planning was changed into the Ministry of the Family Welfare. These are the main important things which is mentioned there. Okay. Any doubt up to this? I hope everything is clear. Some things about STDs should be also shared because STDs are some of the areas which can be asked there. So STDs in that one, at least the causative organism of STD, you have to know what are the causative organism of each STDs which are mentioned there. And viral, bacterial, and the parasitic and the fungal when you come. The viral are coming as the AIDS, herpes, and the warts. AIDS, herpes, and the warts are there. So you have to remember like VA viral, like that you have to remember. VA viral, W-A-H. VA viral, like that you can remember. VA means, W means wart, A means the AIDS, and H means the herpes. W-A-H virus. Yeah, for VA the virus, like that you can remember. The bacterial is like syphilis, gonorrhea, and the cancroid, non-specific enteritis. So bacterial, you keep it there. You can go for the parasitic there. Remember the simple ones, the parasitic one, that is Trichomonas vaginitis and the urethritis, scabies, and the pubis pediculosis. These are for the parasitic. When you come for the fungal There is vulvovaginitis and the balanitis and the vaginal thrush is there. And the all other which are coming not in this group, you can consider it under the bacterial things like the syphilis, gonorrhea, and the non-gonorrheal urethritis, the cancroid, and the granuloma inguinale, which is mentioned there. Next, what is the causative organism of syphilis, which is mentioned there? So here, the age group where the syphilis is attacked is in the age group of 15 to 39 there. And now the syphilis cases are increasing. The causative organism only you have to remember. That is the Treponema pallidum here. And it is repeatedly killed by drying at high temperature. And when you use the soap and the water, this can be easily removed. Mainly thing is that it infectious during the 2-year stages of disease, especially for 2 to 4 years, this can be transmitted there. And the skin exudates and the mucous membrane, through that the virus can come to the syphilis conditions. And through the blood and body fluids, especially the semen or the saliva, vaginal and cervical discharge, this can be exited there. And the incubation period is about 3 weeks there. You have the transmission with the open lesion. That is by sexual contact, kissing, and the contact with baby having congenital syphilis and with contaminated articles there in the open lesion there. And the congenital infection, that is through the transplacental transformation from the 4th month till the delivery there. Inoculation infection is there, that is by contaminated blood and body fluids with the help of syringes and needles and the blood transfusion there. The syphilis, both are there, that is congenital and the acute there. If it is in the case of early syphilis, there are 3 things, like the primary, secondary, and the early latent is there. Late syphilis, there is neurological, cardiovascular, gummatous, and the late latent there. This is the natural history of syphilis, which is told like in 9 to 90 days, that is called as the incubation period there. So 9 syphilis, or you can remember it as Nava syphilis, like that. Nava means you can consider it as 9. So 9 to 90 days is the incubation period. And from there, you start slowly spreading the syphilis, like 6 weeks to 6 months. And then within 2 years, the secondary syphilis will start. And in the early latent, and then you have the latent syphilis conditions is there. And by the time, it might have transformed into neurosyphilis, and it might be affecting the cardiovascular condition there. And this is the distribution of the organism, which all organs is affected there. Mainly the brain or the eye and the ear and the endolimb, with the liver and kidneys will be affected there. You have the primary syphilis. These are the camps which are formed with the primary syphilis. Mainly firm, painless, and then an ulcer formation is formed with enlarged lymph nodes and spontaneously disappears without any kind of treatment in 4 to 6 weeks there. And this is the secondary syphilis. There will be generalized skin rashes with the patchy lesions of the mucous membrane, especially in the mouth region there. And there is involvement of the other parts of the body. Spontaneously, it will disappear within weeks or months, followed by after a latent period. By the 3rd stage, it will disappear there. You have the late symptomatic syphilis there. This is considered as the tertiary syphilis, and it is also considered as the gummatous ulcer. You have to remember like the gum-like of ulcer, or on the ulcer top, you feel the gummy appearance. So here you have the neuro and cardiovascular syphilis, where it is involving different parts of the body there. And how you can identify. Mainly the identification lab investigation is with the dark field microscopic exams there. So you have to remember here like the syphilis in the dark field, And there is serological testing, that is the non-treponemal test there. That is the both the Wassermann reaction and the VDRL testing. So venereal disease research laboratory testing, the VDRL and WRL testing there. And you have the treponemal test, like the treponema antigens with the fluorescent antibody absorption test is also done. And you have the prevention, that is by sexual promiscuity can be avoided. And you have the chemoprophylaxis treatments and all, which is mentioned here. And you have the early case finding and the measures for cases, like the local health authority, you can notify confidentially. Then long-acting penicillins can be given. There is a contact syphilis there that can be traced and enlisted with the help of surveillance and chemoprophylaxis. It can be controlled. The other one is regarding the congenital syphilis by birth, which is handling that. So here it should be proper care should be done. The other one is regarding the gonorrhea conditions. So here in the gonorrhea, the acute infections, especially the STD, becomes chronic if it is neglected there. And the causative organism, it is the Neisseria gonorrhea, and it is a gram-negative bacteria. Sometimes these questions can be asked like, dash is a Dash is caused by Neisseria gonorrhea and it is a gum-negative bacteria. So you can fill in the blanks and such type of questions can be asked as well. So it is gram-negative. So gonorrhea is G and the gram is also G. So GG, like that you have to remember. Gram-negative and the gonorrhea there. You have the reservoir. It's mainly infectious, can be run within the days it will be, and through the mucous membranes, this gets affected to other people also, and direct sexual contact it has there. And 3 to 4 days only, this gonorrhea gets transmitted. And in clinical practice, you have the males and the parietal rosette. These are the main symptoms which is found there. The history and the clinical picture with the lab investigation, and the penicillin prevention is there, amoxicillin, and the main thing, the decking of the diseases of the STDs are coming under the AIDS. We have already discussed under the AIDS control program, National AIDS Control Program. Especially here, there will be a progressive damage here to the immune and other organ system, especially the CNS condition. The causative agent is there, like the HIV, which is RNA retrovirus there. Mainly the HIV-1 and HIV-2 is there. HIV-1 is found in the American, Europe, and Sub-Saharan Africa. HIV-2 is in the West African countries here. You have the virus entering the healthy person and the virus which will be destroying the white T cells, and it will be automatically reproducing itself, and thereby the immune system will be broken down. And once it is broken down, the cells cannot fight the infection when it hands on. And AIDS will take over the years at this stage. Up to 20 years also, the incubation period is there. And the reservoir is man, and the exit is through blood and the body fluids. The infected person is alive there. These are the mode infection and how you can get the HIV here. Through unprotected sex or the pregnancy, and that is not transmitted by the toilet seats or the insects bites. And these are the awareness program. What are the main organs where the AIDS can be affected? What is that? As the brain and the CSF will be affected there, you have the continuous headaches and difficulty in concentrating with the lymph node swelling there. And the skin, you will have the night sweats conditions. So this can be asked. Night sweats are seen in which condition? Once it can be asked. The night sweats are done in the case of skin conditions there. In the case of AIDS, the skin it is represented. And in the cases of nails, there is thickening and curving there. With the severe weight loss and fatigue condition, and also with the joints pain conditions. And this is the specific indicator of diseases, like the opportunistic infection is there. That is the pneumocystitis carinii, and the neurological diseases, mainly dementia or sensory neuropathy is there. And in the cancers, that is Kaposi sarcoma and the Hodgkin's lymphoma, and the extrapulmonary tuberculosis, and the opportunistic infection is like that. The brain, there is cryptococcal meningitis, and the eyes, that is cytomegalovirus, and the mouth and the throat, there is cold sores and ulcers with thrush, that is candidiasis, and the lungs, that is histoplasmosis, and the stomach, that is cytomegalovirus is there, and the liver HCV is there. And these are the main things which are found in the cases of AIDS viruses. So there is laboratory diagnosis, and for that one, main serological test is the ELISA, the Western blot, and the immunofluorescent assay test are being done. And the polymerase chain reaction test. This you might have heard when the COVID was in the limelight, the PCR test like that. So it is also done for the HIV antigens, yeah. And for the control, mainly the drug abuse, syringes can be reduced, and local health authority and WHO should be notified. And you have the treatment of opportunities diseases, like antiretroviral treatment is mentioned. And here you have the post-exposure prophylaxis, like 2 to 3 drugs for 28 days you can take. This can be available as single pill regime here. Then PEP is not 100% effective, and it taking an antiretroviral medication within 72 hours here. You have also the BCG vaccine, explained immunization vaccines. Asymptomatic, if the asymptomatic HIV infected children is there, so they should not receive the BCG vaccine. So sometimes this question can be asked, which vaccine should not be received by an asymptomatic HIV infected children? So the BCG vaccine should not be given, but the MMR and the polio vaccines are recommended for all HIV infected children also. These are all about the WHO recommendations here. I hope there is no doubt. Next is regarding, we will deal with some Janapadodvamsa there. So the Janapadodvamsa, Dushita Bhumi and Vayu and Jala, what are the things which is found there? It's a very simple topic. You have to see only the treatment, what can be done there. So, you know, the Janapadana, what it is, the destruction of larger population, which is termed there. And here you have the Chakrapani, that is called as the Vyadhijanaka Hetu, and the Asadharana and Sadharana Hetus are mentioned. The Asadharana Hetu means which is pertaining to the individuals, which is causing the doshaja vyadhis there. You have the Sadharana Hetu, that is factors relating to the community there. Thereby, you have the air, water, land, and the seasonal pollutions are maintained there. And due to the adharma. So, this can be asked, what is the root cause of Janapadodvamsa? So, sometimes in the options, Pratnyaparada, Adharma can all be seen there. So, Janapadodvamsa is caused by Adharma and Pratnyaparada. And what are the Nidhana, that is Niyathantakam Paryaya Hetu, Aniyathantakam Paryaya Hetu. Like inevitable disastrous factors is called as Niyathantakam Paryaya Hetu, and Aniyathantakam Paryaya Hetu, that is man-made, especially the wars and terrorism. And there is Janapadodvamsakara Bhavas is there, that is Vayu, Jala, Desha, and the Kala aspects which is told there. So here in the cases of Vayu, sometimes the wind will be moving on in a whirling circles, that is, will not be following a particular disha, that is especially applicable for the Vayu there. And there is Atistimita, or the excessive moistness in the atmosphere. So this can be asked. Atistimita and Adichala is explained for which kind of Vayu or which kind of Janapadodvamsakara Bhava. So it is explained for the Vayu or the air pollution there. And you have the extreme temperatures like excessive cold or the excessive hot. Ati Sheetam and Ati Ushnam is also done there. Ati Parusham and Ati Chala is also there. You have the Ati Ruksha and Ati Abhishanti conditions and Ati Bhairavaaravam, that is terribly sounding there, which excessively clashing and forming a cyclones there. And you have the unsuitable smell, the vapor, gravel, dust and smoke will be there everywhere here. You have the Jala. So in the cases of Janapadodvamsakara Bhava as Jala, you have the Jala which is having Vikrita Gandha Varna Rasa Sparsha. Okay, and Kleda Bahala, two slimy appearance is there. And there is no aquatic birds or animals inside the aquatic terrains there. And if at all it is there, it will be in reduced number, maybe one or two only you can find it. And the water is very unpleasing for you. And it will lose the qualities which is told there. When it is coming to the Janapadodvamsakara Desha, there is excessive moisture and it is inhabited by reptiles, violent animals, the mosquitoes and the flies. And you have the growths and the grasses with a lot of creepers which is there. Then you have the Apuravat Avapadita Shushka Nashtashyasa. That is, it has a new look with the fallen, dried and damaged conditions with the smoky wings there. And you can see the animals and the birds which are in a panic and painful conditions there. And the areas people which are not having the dharma, they are not following the dharma there. That is also seen here in this condition. And overflooded water bodies, that is the constantly agitated, overflooded water bodies are found here. Then you have the Pradata Ulkapada. This also can be asked. Pradata Ulkapada is particularly seen in which Janapadodvamsakara Bhava, and the Bhumikampa and the earthquakes are also found with the fierce and the crying appearance, with the confusion and the excitement condition, with the excessive torture and crying, and also the darkness condition here. And these are about the Kala. Like in the Kala, you can see particular condition is told, but the opposite of it is happening there. And how you can prevent that. That is immune against the diseases, how it can be. So you can take it as Satyam Bhudadeyam, Dhanam Balidevatarchana, Sadvrata Anivartana, Sevana, Brahmacharya, and Dharmashastra Kadana are one of the prevention and control for the chickles of Janapadodvamsa. So it can be asked like, what are the two main treatments which is adopted for Janapadodvamsa? That is Panchakarma and the Rasayana Chikitsa is explained there. Mainly some of the other references are also there. Like in the case of Jala, you can use the Kataka Bija. For the Desha, you can use the aromatic plants like the Ushira can be used there. Or you can use the Vata, Udumbara like that. Big trees can be used there. It can be planted there. And Dushita Vayu means mainly the aromatic plant should be there in the vicinity of Dushita Vayu there. This is all about the Janabodvamsa. I hope there is no doubt. I hope there is no doubt. Any other doubt? I think in between, no, I will tell a story, okay? So that you understand what it is. So once there was an old man, okay? Once there was an old man, and that old man once found once took a horse from the market, but he was not having that much money. Okay, once he found the horse and he took the horse from the market, he brought it into his village. What the village people started telling, how he's spending, why he is spending a lot of money. At least he should save on the family. Why he is spending on it? Like that, it was asked. So the grand old man did not tell anything. And one fine day, the horse was missing because horse was not nowhere found there, and the horse was missing there. And suddenly the people started telling like, it was good, like he has bought one horse from the market, and then we had told them not to buy there, and now the horse ran away. And after many days, the horse returned with 10 other horses from the forest. Okay. Then everyone started telling, praising him like, it was a good thing. Like you have got 10 horses instead of one. You are the lucky person who have brought the horses on that day. That was the best thing. Then also the old man was not telling anything. Then one day, the grandfather, that old man's grandchild, stepped down to the one of the horses, and then he fell down. And then he fell down. He had fractures. He had fractures in his hands and his fractures in the legs there. And then everyone started blaming again the old man, like, why you have made the horses to bring here. It was best there was no horse, because your grandchild has fallen from the horse and he has multiple kind of fractures. What kind of an old man are you, or what kind of a grandfather are you? The people started blaming him. Then also he was silent. And one fine day there was a war which happened there, and the war was like, every children or every teenage people has to go for the war. But as the grandchild was having multiple fractures, he was not admitted for the war there. Then this is how the people will change, and this is how the circumstances in life will change. So you have to remember, like, whatever may be the circumstances, but still you have to do your duties. Whatever may be the circumstances, can be good or the circumstances can be bad. Whatever may be the conditions, the life has to go on, or your work has to go on. The karma pade, anasritaha karma padaha, karye karana bhave, like that it is told. Whatever you do, it should be in proper manner, should be done. It should be in continuous, like you tell the consistency there. Understood? Any doubt? Okay. Now we will go for the other part, that is regarding the milk-borne diseases, the milk quality, and the milk pasteurization. These are some of the areas where the questions are asked. So when we come to the milk-borne diseases, there is cow's milk and the hen's egg and also mentioned there. Here, the nearly perfect food which is told there. And the milk is considered as the best and complete foods. And the human, cow, buffalo, and the cheese is also mentioned here. And milk as a wholesome food. And you have the milk protein, which is present, is considered as casein. Okay. And you have every nutrients and the vitamins except vitamin C and the iron. Iron and vitamin C is not there. So this can be asked sometimes, which vitamin is not present in milk? It is vitamin C. Okay. And milk fat is good source of carotene, and it contains saturated fatty acids with other proteins like lactalbumin and lactoglobulin there. And the carbohydrate in the milk is lactose there. And milk is the only natural source of the lactose here. And you have 85% water and a poor source of energy, which can be easily adulterated. And it is a poor source of iron and vitamin C, and a good medium for organism to grow here. So you have the milk products. These are all the milk products which is told, like the fermented milk products, yogurt, curd, and the cheese, and the milk, other forms like paneer, khova, butter, ghee, and the whole milk there. And this is all about the types of milk, that is the derived milk and the homogenized milk here. So fat in the milk is present in the form of droplets here, or the globules, which is from 1 to 10 microns here. And whenever the milk droplets or the fat droplets accustomed on the upper surface, this is considered as the scum or the cream part of it. Then whenever it is passed with a high pressure, the flat globules are broken up, and there it is called as homogenized milk here. And it can be readily digested by infants than the ordinary milk here. These are the types of milk which is told, like that standardized milk is there. That is all the standardized milk, and the homogenized milk is there. Homogenized milk we have already discussed here. And the skimmed milk is there. That is the milk from which fat is skimmed off. That is called as a slim and trim milk. And here it doesn't contain the fat soluble vitamins. So this can be asked like which are all the vitamins which is not present in the cases of skimmed milk. That is vitamin A, D and A, D, E and K is not present in the skimmed milk here. And it should not be given to the infants there. And it is rich in milk protein and the calcium. And when you can dry, it becomes the skimmed milk powder there. And you have the Hyderabadi mix. It is a supplementary food. One of the main content of this skimmed milk powder is the Hyderabadi mix is the skimmed milk powder. And these are the evaporated milk and the condensed milk. Evaporated milk, you have this 50% will be evaporation and going. The condensed milk is that it will be reduced to 25% of its volume by the evaporation. And the condensed milk has less nutritive value than the pure milk. And in there is bacterial growth is more than. That's why the condensed milk is less given for the infants then. You have the dried milk powder. The thing is that the milk will be passed through steam heated rollers or the rotating drums. And finally, it reduced to a fine powder form. And powder will be forming a thin layer over the drum there, and it is scraped down with the particles there. You have the toned milk. Toned milk is like 1 part of water and the 1 part of milk and 1/8 part of skimmed milk powder which is being added there. And it is similar to the cow's milk there. You have the vegetable milk. This is prepared from groundnut and the soya bean. And it can be substitute for the animal milk which is told there. You have the milk standards. Like the milk should be free from peculiar smell and taste. And you have the cow's milk, wherein the 8.5% of SNF is told. And the buffalo milk is there, where the milk fat is less than 6%. The toned milk is there, where the fat is 3%, and the SNF is about 8.5%. And when you go to the milk-borne diseases there, the main important things which is told, like the WHO export committee was maintained on the milk hygiene. You have already the nutrition and the anemia program in the 1970. One more is there is regarding the milk hygiene classification there. So what are the diseases which can infect the man from the animal there? So one is the tuberculosis, other is the brucellosis, and the next one is the streptococcal, staphylococcal, salmonellosis, and the Q fever conditions here. So you have the tick-borne encephalitis and the cowpox, anthrax, and the foot and mouth diseases here. You have the diarrheal diseases here, like the paratyphoid, the typhoid, shigellosis, and the cholera, and the E. coli bacteria. And through the milk, they are the diphtheria, TB, and the viral hepatitis. And you have the common source of milk supply. Like the children are usually the milk-borne epidemic conditions, transmitted areas, and how you can avoid it. The thing is that maintaining a personal hygiene there. And you have the areas of pasteurization. Like these are the 3 methods where the pasteurization is generally done. The Holder method, HTST method, and the UHT method there. Holder method is a VAT process, which is called as the holding process. HTST method is that is a high temperature short time method. That is also called as the flash process. Sometimes this question can be asked that the flash process, how it can be. Then the UHT, that is the ultra high temperature, which is told there. The holder method is there. That's called as the VAT process or the holding process, wherein the milk is heated to 65 degrees Celsius and maintained at this temperature for about 30 minutes there. And it is cooled to a temperature of below 5 degrees Celsius. And this method is called as the British method or the slow method there. Here you have the LT method. High temperature and short time processes there. That's called as the HTST or the flash process here. It is also considered as the American method. So this type of questions can be asked, which is the American method, which is the British method. So the American method is the older method or the fast process. So you have to think like the British people are holding the Indians. The British people were the people who have held the India, and the Americans were very angry people. You have to remember like high temperature. So high temperature is the American method. Ultra high temperature is there, wherein normal pressure to 88 degrees Celsius for few seconds, and in the second stage, 125 degrees Celsius under the pressure for few seconds there. And in pasteurization, 90% of the pathogens and the lactobacilli are destroyed and not the spores there. Also, the milk is kept cold in the subsequent nice temperature. And you have the sterilization process and also the test for adulteration. Test for pasteurization. These are the main tests for pasteurization. Phosphatase, methylene blue test, standard plate count, and the coliform count. So sometimes this test can be given and it can be asked like, what are the tests for pasteurization, which is told here. You have the phosphatase test, like the phosphatase wherein disodium phenyl phosphate is added and intubated. Methylene blue test is there, which detect the presence of bacilli. And discoloration means it indicates the bacterial presence. Bacteriological quality of pasteurized milk is there. The permissible limit is about 30,000 bacteria per ml. You have the coliform count. So it should be 0 or absent. These are all the things which is told. Understood up to this? Any doubt? So I think major things we have covered. There are some things about the diseases part which is mentioned. So main disease which is covered in the cases of PSM is regarding the cholera. You have the John Snow, which is considered as the cholera, which is who is the father of epidemiology. And here you have the epidemiological study designs, the preventive design, the public health, and you have the unit of study and the public health and the clinical modium, the areas of concern and the shortcomings, what it is. Also, the community health is also maintained there. You have the Ahara Vidhi. Another important area is regarding the Ahara Vidhi. So in the cases of Ahara Vidhi, that is Aharatastu or Ahara is considered as Mahabhaishajya is told by which Acharya? It is by Kashyapa, okay? That is one of the repeated questions which is asked. You have the Ahara, like it is of 6 types. Ahara is of 6 types. That is Chushya, Peya, Leha, Bhakshya, Bhojya, and the Charvya, according to Bhava Prakasha. And based on the Guna, there is 20 types. That is the Guru, Laghu, and Shita, and Ushna. And Snigdha, it is Ruksha, Manda, and Tikshna. And Sthira is Sara, Mrudu, and Katina. And Vishada is Pichila, Shlakshna, and the Kara. And Sukshma is Stula, Sandra, and the Dravade. And based on the Vikalpa, it is Aparisankhya, innumerable in number. And based on the Varga, it is Shuga, Shamidanya, and the Mansa, Ikshu, and the Kritana Varga, and the Ahara Yoni. You have the Dravadravya Varga, that is Jala, Kshira, Dadi, Takra, Grita, Taila, Madhu, and Ikshu is there. And the Annapana Varga, that is Shali, Kritana, Bhakshya, and Sarva Anupana is there. So these are the Ahara Vidhi. According to Charaka, it says regarding the Ahara, Kerana, Samyoga, Rashi, Desha, Kala, Upyoga Samstha, Ushna, Snigdha, Parimana. These are all some of the things which is told by Charaka. Like one gives happiness to the mind, that is called as Ishtadesha Bhojana. And you have Shigra Bhojana. Like the food will be tasteless when it is consumed fast. Alasya Bhojana is also there, and satisfaction. And the Mauna Bhojana is there. Like you have the laughing will prevent the air of etching, and the Atma Vivikshana, paying total attention while you take food. The Patya, it is mentioned. Dwadasha Anna Vichara is there. 12 principles about diet can be explained there. So here you have Shita Guna Ahara, that is Shita is considered as Trishna Kara, and Ushnata will increase, and madness will increase. Daha, Raktapitta, and Visha will be there. For the Ushna Guna Ahara, it is Kapavada Rogi and Sneha Pai, which is mentioned. You have the Snigdha aspects. Okay, for the Snigdha, it is Vata Prakriti and the Viduksha Dehi, which is told. And Dravahara, Shushka Deha, and Daurpala. And it is a proper time to take food. That is Kukshi Shitila at that conditions. And Deho Hi Ahara Sambhava, like that it is told here. Then you have something regarding we will take with the PDF aspects, okay? So whenever we come to the Swasthavritta aspects, it is told as Dharmata Kama Mokshana, like that it is told there, Arogya Mula Uttamam. Like that criteria are also told there. And you have the Rogastu Dosha Vaishamya and all is mentioned. These are the general things. There is no need of repeatedly telling that because you know regarding Swastha, Arogya Paribhasha, Dinacharya and Dinacharya Krama, everything you know. So there is no need of taking into much consideration. Rasadhatu Sambandha is there, and there are some things which is mentioned for after immediately getting up there. So the Dinacharya aspect. So here in Dirghan Chivati Vichara and all, in Samhitas, the references of Swasthavritta is explained. And Anagata Bhada Pradisheda and Aishkamya Vichara of Vagpata and Shushruta, there and all you get the reference of for Swasthavritta. The Dinacharya is there. The Dinacharya, and the Dinacharya and the Ratricharya is also there. In the Dinacharya, you have the Anjana, Dandapavana, and Pradaruttana, like that. Pradaruttana means Brahman Murta Uttishta, that one. Jirna Jirna Nirasyavam, Brahman Murta Uttishta, Swastha Rakshartam Aishaha. These are the main quotation which explains regarding Dinacharya. And the Brahma Murta means Ratraistaha Paschimo, like before 2 Gataga prior to the Suryodaya. Like it's just 96 minutes or 1 Prahara before the sunrise. 1 Prahara means about 1.5 before the sunrise. If the sunrise is approximately 6:15, you remember it is 6:15 or 6 o'clock. Remember it as 6 o'clock. So about 1.5 hour means approximately it will be about 4:30, 4 o'clock or 4:30 timing is considered as the Brahma Muhurta timing there. And you have the Balaka, Rukna and Ratri Jagarida people. No need to get up early in the morning. And immediately after getting up, 8 Anjali Pramana, like Ardhakvatita Jalapana for the Krisha and Pitta Prakriti person, Suvarna Patra Jalapana for the Stula person, Tamra Patra Jalapana is told as the Ushapana there. And according to Bhav Prakasha, in Pradha Kala, 3 Anjali Nasadhara Jalapana is called Nasadhara Jalapana. That is considered as the Jalaneti you can correlate, and that is good for the proper vision there. And other than the Ushapana, there are some of the references like proper washing of the face is also done. Prakshalana, Mukha Prakshalana is also told that for the Mukha Prakshalana, mainly Lodra like drugs. Lodra can be taken, it can be boiled, and with that water, the Mukha Prakshalana can be done there. You have the Malavisurjana there. Malavisurjana is it is Rakshartama Aisha Susta, and In the morning time, the Uttara Disha Mukha, and in the Ratri, Dakshina Disha Mukha should be chosen for the Malavisarchana there. You have the Danda Davana, that is Dwakalo, it is told by 2 times brushing is told by Charaka Sutra. Chakrapana is also told like Pradha Kala and Sanchaya Kala. And Vriddha Vagbhita says like, in the early morning, it is told, but he should not brush the teeth after every meal. Bhojana pascha danda davana nishiddha, like that which is told. And in avasthas, instead of such conditions, you cannot go for the brushing, you go for the gandusha, and that is having extra benefits than the brushing there. And the danda davana kashta should be about 12 angula, and the thickness is about the kanishtika pramana, and the jihva nirlegana, it is about 10 angula there. So you have to remember like, the jihva, 10 is written there. The jihva, you are scraping the jihva in the size of 10. You're scraping it in the shape of 10. Like that you have to remember. Then Mangalastu Darshana, Dadi, Grita, Durva, Rajika, and all should be seen first for the Mangalastu Darshana. Or the Raja, Surya, Jala, Suvarna, and all should be seen first here. You have the Bhojana Kala, where you have the Sayam, Pradar, Manishyanam, Ashamanam, Shrudicha Udidam. So it is Udgar Shuddhe so, and Jala after the Bhojana Sambandha. Like Yuktasya Adu Jalam, Puitamakmi Sadam, Kushangadam. You have the Rasanusara, Ahara Sevana Krama is also told here. Like Ashniya Tama, Bhuktva Purva, like that is also mentioned. And you have the Rasanusara Ahara Sevana. And the Ahara Gataka is like the Shugadanya. Rektashala is Shreshta among all the things. Then the Shashtika Shali is the Shreshta. And Godhuma, it is Brahmana, Vrishya, Snigdha, and Staidekara and Guru is told there. You have the Jowar. The Jowar is the Madhura, Shita, and Vata Kapha Vardhaga there. And the Vajra, it is Madhura Kashaya, Alpa Ushna, and it is Pitta Karamor. So Vata Kapha Vardhaka is the Jwari, and the Yava is it. So Ekdam Shreshta, one among the Shreshta is considered as Yava because it is Balya and Shleshma Viranut, like it reduces the Kapha. And Bahuvada Shakrada Yavaha, Stairekritsa Kashayascha. And you have the Shimbidanya and the Mudga there. So here the Mudga is like Kashaya Madhuro, Rukshaha, Shitaha, Pake, Katur Lagu is told there. And you have the Tuvara or the Adagi, which will increase the Pitta Prakopa, and the Masha gram here, Kulato Grahinaha is told there. And the Lagu, Madhura, Kashaya, Shita Virya is told for the Chana and Masura. And Tila, it is Krishna Tila is Reshta, Sumba Bija is there. And you have the Shaga Varga here. That's just one time readable is enough for you. That is on same left. You have the Phala Varga, that is the Amla, Pavla, that's things and all, Arigela. Importantly, what are the doshas which is related? When you take the things, that is all mentioned here. Okay. The Kadali, Fanida is mentioned, then Puranaguda and Navaguda. So Puranaguda is Paktya and Hrudya and the Hrudya. Nava is Sleshma and Agnisada. It will increase the Agnisada, and the Duddha Pariksha is there. Like the Lavana in the test tube you can take, and the method of preservation of food, that is the cold, salting methods or dehydration and drying processes. Here the model public health was maintained there. We have the specific gravity of milk there, like the methods of food adulteration, wherein mixing, substitution, and the decomposed food is taken for the food standards are like the Codex Alimentarius and the PFA standards. These are the nutrition programs in India, which is run by there. The vitamin A prophylaxis is told for the Ministry of Health and Child Welfare. sorry, Ministry of Health and Family Welfare there. You have the vitamin A, you have the prophylaxis against nutritional anemia, that is also by Ministry of Health and Family Welfare. Only thing is a special nutrition program and the Balavadi nutrition program and the ICDS program. These are all run by the Ministry of Social Welfare there. Midday meal program is run by the Ministry of Education. So that can be asked. Midday meal program is run by which ministry? So it is run by the Ministry of Education. The midday meal scheme is there. That is by the Ministry of Human Resource Development there. You have the Sangramaka Vyadhi or the infectious diseases there. So that is Prasanga, Gatraspanshashta, that is the quotation which is told for the infectious diseases there. And you have the Atharva Veda. In the Atharva Veda, the Krimi is told as Drishya and Adrishya. And Vedok, the Krimi is done for the Raksha Karma. And the Vedic Shamatva is there. That is the Sahaja, Kalaja, and Yuktikrita. The immunoglobulins is there, like the IgG, IgA, IgM, IgD is there. And the Vedic Shamatva is there. That is the Swambhavika and Abhayagara, Jadigada is there. And you have the air capacities, which is mentioned, and the cross ventilation. These are all just one-time readable only, that is only needed. And we have some references for yoga also. We will cover something about yoga also, and then we will wind up the classes. So here, okay. Here you have to remember regarding the Patanjali Yoga Sutra. Like, you know how the word yoga is derived? Like, it is yojastu yujjade anenedi yoga. That is the correlation which is told for the yoga. And Swami Vivekananda has put forward two parts of yoga. One is the Jnana Yoga, and the other one is Raja Yoga, Bhakti Yoga, and the Karma Yoga there. 4 streams of yoga. So that is Jnana Yoga, Raja Yoga, Bhakti Yoga, and the Karma Yoga are the 4 parts of yoga which is put forward by Swami Vivekananda there. And yoga is also having the synonym like Yujja Samadhatvad, like that is also told. And Yogastha Chittavritti Nirodha is told by Patanjali. And Chittavrittis are Pramana, Viparya, Vikalpa, Nidra, and Smriti is also told there. And Manaprashamano Upaya Yoga, that is for the Yoga Vasishta. And Siddhi Siddhayo Samabhuktva Samatvam Yoga Uchade, that is told from Bhagavad Gita there. And Yogasu Karmasu Kaushalam, that is done for Bhagavad Gita there. And Dukkha Samyoga Viyoga Yoga Sanyanam, that is done for the Gita there. And Yogo Moksha Pravartakaha, it is told by Charaka. And Pancha Klesha is there, that is the Avidya, Ashmita, Raga, Dvesha, and Abhinivesha is told there. And Goraksha Samhita, it is told there. Yogi Gorakhnath has told there. And you have the Shatkarmas, one of the important areas where the question can be asked regarding the Shatkarmas is there. So in the Shatkarmas, it is Hatha Yoga and Geranda Samhita describes about 6 cleansing practices to remove the excess kapha and the medas there. Hatha Yoga and Geranda Samhita. So they are Dauti, Vasti, Neti, Trataka, Nauli, and Kapalabhati. These are the 6 karmas or the Shat karmas which is told there. And Geranda Samhita classifies the Dauti again. So that is Andar Dauti, Danda Dauti, Hrid Dauti, and Molishodhana. These are the 4 type of classification of Dauti which is told by Geranda Samhita. That is the 4 classification which is told by Geranda Samhita there. So here you have Andar Dauti, Danda Dauti, Hrid Dauti, and Moola Dauti there. So that also I will write. Andar Dauti is there. Then Danda Dauti is there. You have the Hrid Dauti. Then the Moola Dauti. These are the important things which is told there. Then you have the Kapalabhati. That is 3 times which is told there in Kapalabhati. That is Vamakrama, which is told there. Vamakrama is also told there. Then you've drawn the air through the left and expel through the right. It's left, you have to take it to the left and expel through the right there. And next through the right and expel through the left there. This is the Balabhati in Gyananda Samhita, which is mentioned there. And Yudkrama is there. That is the water through the two nostrils you are, and then you are expelling through the mouth. And also the Sidkrama is there. One is the Vyudkrama and the other one is the Sidkrama. That is the water through the mouth and expelled through the nostrils. Vice versa is considered as Sidkrama and also the Vyudkrama there. And the total number of nadis, which is told, is total 72,000 in number. The total nadis are total 72,000 there. And you have the three important ones called as the Ida, Pingala, and Sushumna Nadi. Ida is in the left nostril. Ida is in the left nostril. And the Chandrakala, it represents the coolingness of our body. Then it represents the moon there. And it is positioned on the left side there. And it is the Pingala, it is all about the right nostril there. And it is considered as the Vishakala there, the Vishakala. And it is represent the sun and the position on the right side of the spinal cord there. And the Sushumna represents the Kundalini. And it is positioned on the spinal cord. These are the three things which is present for the Ida, Pingala, and also Sushumna there. So you have to remember like the left side. So okay, here you have, color is not coming. 1 minute. Okay, you have the Ida and the Pingala there. So the Ida is like the left nostril. And you have the Chandra there. And the Pingala is there. That is the right nostril. And it is Chandra there. Sorry, Surya there. And Sushumna is a Kundalini there. And it is on the spinal cord which is present. These are the three things which is told there. And you have the asanas there. According to Gyananda Samhita, there are 84 lakhs of asana which is told there. And which is told by Shiva actually. And out of this, 84 asanas are the best, like that which is told there. And among the 84, there are 32 asana which is mentioned, which is beneficial for the humankind there. And in Upanishads, the asanas are told as asankheya, like that it is told there. You have yoga pradibandhakara bhavas. Yoga pradibandhakara bhavas, it's total 6 in number. Atyahara, Prayascha, Prajalpo, Nivamagraha, Janasanga, and the Laulyam is told for the Yoga Pradinidhikara Bhavas, Yoga Pradibandhakara Bhava, and Bhujangasana. Okay, Bhujangasana is Agni Vardhana there, and Sarvaroga Vinashana. So sometimes the questions can be asked like which asana is Sarvaroga Vinashana? That is the Sarvaroga Vinashana is the Bhujangasana there. Then Mayurasana is there. Mayurasana is the asana which reduces the defects of unwholesome food. If you have taken the unwholesome food, doing the Mayurasana will reduce the effect of it. Then you have the meditative asanas. The meditative asanas are the Siddhasana is there. You have the Padmasana, Bhadrasana, and the Vajrasana, which is told, and the Swastikasana and the Muktasana is also told there. You have the Matsyendra Asana, Paschimottasana, Hermitage of Yogi, that is the Dhanu Pramana here. Then the Kumbhaka should be practiced 4 times a day. Kumbhaka should be practiced 4 times a day, like Pratah Kala, Madhyana Kala, Sayankala, and Ardharatri. Slowly you can raise to 80 counts in one sitting. That is called as the Kumbhaka. Then you have the Surya Bhedi Pranayama, that is called as the Kapala Shodhana, Vata, and Krimi Doshana there. The Bastika Pranayama is there. The Bastrika, which will imbalance, the Bastrika will reduce to the, or correct the imbalance of the Tridoshas. And it is Agnivardhana, the Vastika Pranayama, and the Brahmari is there. That is Chitte Jata Ananda Leela. And in the Murcha or Mano Murcha Sukhaprada, like in the cases of healing powers, this Brahmari has given importance there. And you have the Bastrika, other than the Bastrika, Sheetkari Pranayama, sir. Sheetkari, that is Kamadeva Dvitiyaga, like that is told there. And Sheetali will cure the Gulma conditions. It will clear the Gulma and the Pliha diseases, the Gulma, Pliha diseases, Jwara and Pitta diseases, and also Shut and Trishna is also cleared. Shut and Trishna will be also cleared there. And once the improper practice is done, it can lead to Hiko, Shwasa, Kasa, Sira, Karna, and Akshivedana. And these are the important parts which is told there. Then the other one is regarding little bit about the diseases there. So almost the diseases, the Factory Act and all we have mentioned there, the diseases and all. You have the occupational diseases are mentioned there. So in the occupational diseases, you have the silicosis. By inhaling the silica dust, this is considered as silicosis. Anthracosis means it is with the coal dust. Anthracosis is with the coal dust. Asbestosis, with the asbestos dust, it is coming there. And the bicyanosis is there with the cotton fiber. So how you have to remember the bicyanosis is like the business of cotton business or business of cotton, you have to remember. So bicyanosis, you will get the cotton. Why you have to get the code? Because other one is coming as bagosis. Bagosis is told for the molasses or the sugarcane there. So you have to remember like the bag of sugarcane, like that you have to remember. Berylliosis is there, that is told for the beryllium there. And the farmer's lung is there, that is called as the mouldy hay, the farmer's lung. And the siderosis is there, siderosis or the iron dust. And stanosis is there, stanosis is the tin dust there. So tin is ST, so tin is ST after. And the compost lung is there, the compost one. And the bird fancier's lung is there, that is the avian and the bird droppings there. These are the important areas where it can be asked. And you have the lead poisoning. There are some of the poisoning conditions we also mentioned in the PSM there. So the lead poison, that is considered as the plumbism or the saturnism, or it is also called as painter's colic, because the painting people are repeatedly in contact with the lead poisoning. So that is why you have to remember like the painter's colic there. And the greatest source of lead poisoning is by plumbism, saturnism, or the painter's colic. And it is the mode of absorption is by the inhalation. You have the facial pallor, anemia, the microscopic and the punctate basophilia. The Bartonian line is there. That is the lead sulfide lines on the upper jaw there. And the lead colic is there. That is considered as the constipation there. Then the ergonomics is there. Ergonomics means you are using the environment for the human use. That is considered as the ergonomics parts there. Then you have the disaster and management. That is considered the triage system. Already in the pediatric diseases, we've already discussed regarding the color codes. The triage system is there, like red means you have to give the highest priority, and then immediate resuscitation or life-saving surgeries should be done in the case of next 6 hours. That is the red color. Yellow means high priority, within 24 hours you have to treat that. And the green means the low priority there. That is minor illness or ambulatory patients are correlated under the low priority conditions there. So this is all about the disaster and occupational health programs there. And there is some life cycle of mosquitoes is mentioned there. About 8 to 34 days are the life cycle of mosquitoes, which is mentioned. The phosphatase test is there. That is widely used to test there. The standard plate count is there. That is the enforced limit is about 30,000 bacterial pound per ml of pasteurized milk, which is told there. An adult tablet of IFAs contains about 100 milligram of elemental iron, which is told there. And the first antenatal visit is about the early registration. And the second antenatal registration is between 14 to 26 weeks of pregnancy conditions. And third is within 28 to 34 weeks, which is told there. The vitamin A, it is considered as self-thalmia, you are knowing. Vitamin D is considered as the rickets and osteomalacia. And the vitamin K, it is a prothrombin, and vitamin B1 thiamine is considered as a beriberi and the vernix encephalopathy. And vitamin B2 is the riboflavin, that is considered as the angular stomatitis there. These are the important areas which is covered in the cases of Swasthavritta. I hope this is clear. Any other doubt, you can ask me by messaging in the WhatsApp groups, okay? Sorry, in the YouTube platforms or in the Ayurveda Bharati Telegram, okay? So thank you. Study well. Good night.